Hello, I'm Claudia, and I will be presenting our work exploring situated and embodied support for youth's mental health using an interactive, tangible device. Let's start by the motivation of this work. Recent reports have shown that young people are at most risk of mental health disorders, yet less than 1/3 receive any treatment. To address this issue, a growing body of research in psychology and HCI is focusing on the design of scalable and accessible solutions that can offer emotional support as and when they need it the most. One arm of this work looks specifically at developing emotion regulation skills, which has been shown to be a protective factor that can prevent and mitigate mental health conditions. Most commonly, work in this space has explored top-down and module-based interventions. Still, one of the open challenges is how to effectively support young people in the moments when they have to cope with emotionally difficult situations. In this work, we aim to address that challenge by exploring the potential of interactive, tangible devices as a way of enabling embodied, ongoing, and in-the-moment support to help young people practice emotion regulation skills in their everyday lives. For this study, we used Purple as an illustration of such an interactive, tangible device providing situated and embodied support. Purple is a research prototype turned into a commercial product that was originally designed to scaffold children's practice of emotion regulation skills through in-the-moment support and experiential learning. The interactions embodying the emotion regulation process are very simple. Purple is a little creature that gets anxious easily, and its racing heartbeat calms down into a purr when gently and continuously stroked by humans for a couple of minutes. In the references and in our paper, you can find more information. Regarding the methodology of the study, it was structured in 2 steps. In step 1, we deployed Purple with 2 populations of young people for about 1.5 months, followed by a series of semi-structured interviews with a subsample of the participants to learn about their experience with the device. In step 2, we run a series of co-designed workshops with another subsample of participants to explore more broadly how young people imagine such situated and embodied support for emotion regulation, and even how interactive devices could help deliver such support. Overall, the majority of our participants reported that Purple had a positive impact. Most of them found the embodied interactions particularly useful as a way of calming down in moments when they felt anxious, stressed, or overwhelmed. I will now provide illustrations of some of the key findings from our study that we believe can be interesting beyond Purple, but please refer to the paper for the full details. The tactile affordances and simple interactions of the device seem to be a key aspect from which effects emerged. Participants described how they normally found cognitive strategies for emotion regulation effortful and challenging, and that by introducing Purple in such practices, it helped them anchor their attention, ground them in the present moment, and feel more in control. For example, as stated in this quote, using Purple as a physical token during meditation. Another interesting finding is that in many cases, Purple became a compassionate emotional companion with whom to navigate difficult moments with. This mostly seems to come from the ongoing nurturing engagements participants had with the device, which emerged from the original design value of Purple evoking vulnerability through its appearance and haptic feedback to represent emotions. For example, participants reported finding similar benefits to socially regulating others' emotions when interacting with the device. Many also experienced an increased sense of agency and control as they felt more capable of managing their emotions without the need of immediately seeking support in friends or family. It also seems to have encouraged several participants to adopt an attitude of self-compassion and kindness rather than judgment in moments when they were feeling particularly anxious or overwhelmed, as stated in the quote. Finally, most participants described how they would normally forget to reach out to support, verbal or other, at times when they needed it the most. And it was interesting how they put in place and used different strategies to overcome this challenge. These mechanisms for repeated engagement seem to be mostly grounded on the physicality and familiarity of interacting with verbal. They knew that the tactile interactions would most times lead to soothing and grounding effects, and so the mere presence of the device usually served as a physical reminder to check on their emotions and practice self-care. As such, most participants shared that they liked to keep verbal within sight so that they would remember to use it as and when needed, and would try to build routines around it, for example, keeping it on the bed to build a positive bedtime routine, or on their desk to aid with work-related stress. We now reflect on our findings and abstract them into broader design implications that we believe can open up the design space of situated and embodied support, and specifically to help young people with emotion regulation using interactive, tangible devices. An interesting aspect about the physicality and haptic feedback of verbal is how it supports the practice of emotion regulation strategies with experiential learning. We argue that interaction modalities that allow for a felt, subtle, and inward-looking experience could be particularly useful in this application space to scaffold the user's experience and nudge them towards a particular emotional trajectory that would otherwise be unavailable to them. The next question is how to design these embodied experiences to support distinct emotional trajectories as and when they occur in everyday life. We see potential in embedding these gentle, tactile trajectories for emotion regulation in traditional digital technologies already present in young people's lives. For example, in smartphones or social media apps, to bring additional depth to these experiences with instant support tailored to the context. Finally, some of our participants who disclosed living with mental health conditions found value in using the tangible device to help them practice skills and strategies learned in therapy in the moments they perceived as challenging. Therefore, another open question is to what extent situated and embodied interventions, such as the one verbal provides, could serve as complements to existing mental health interventions to explicitly scaffold the transfer of taught skills from sessions into daily life. Thank you for your attention. Please reach out if you have any questions.